sake of examination preparation, this will be very helpful and high yielding topics we are going to discuss today according to your syllabus and according to the previous year question paper and how to write the answer. All these things we can discuss and we can learn together with Nursing Guru. So welcome one and all of you. I thought everybody had your tea and all. If you want any doubt and all, please do live chat, like comments in the live chat. I can be reply for that. So I can we can like we can talk and learn. Okay, so if you have any doubt, you can go with that. ஒரு phone வேணும். Okay, so foundation, when it comes to the foundation, we can first talk like what are the general things which will be there in this particular subject, that we can discuss. Then later on we can go through that complete subject review, syllabus review. So we will start. Shall I start? You just do a message or the comment in the live chat. I can like it is easy to like start the class. Sound was not there. Am I audible? Hello? Sound was there? When the supply, yeah, we will give information regarding the supply also. And first you are attending first time means you go through that current examinations. Supply, I think along with this only you can write. Any other things? All of you completed your tea and all, have you had? And what about your preparation? Please do comment. Phone வேணும்டா. So how was the, like, you have some stress and all? No, don't go with stress, don't go with fear, because now you can learn. Okay, you can learn, you can finish it off. Definitely you can finish it off if you are using, if you are watching our live sessions. Definitely you can finish it off in a very short duration. All the syllabus, all the complete examination preparation, you are going to finish it off, so that if you have any queries, you can ask. When the supply, we will inform. So who are not yet joined, kindly join fastly. We can start with the session today. FON, what is FON? We will call it as the fundamentals of nursing, or we will call it as a nursing foundation. Okay, so whatever it will be there, we can the same subject. And in this particular subject, now my sound is audible. Shruti ma'am was yeah, ma'am will come. Ma'am was not there today. Today the entire session I'm gonna take care. Thanks for asking. Ma'am, please give 1 mark question. Yeah, at last of the session we are discussing, no, the entire what we can discuss in the last, we are going to discuss the question paper analysis. No, by the time I will give the 1 mark questions, 3 mark questions, short answers, and we are going with the true or false, and mainly we are going with the fill in the blanks. Each and every part will be there, no? So in that, whatever the things which is very necessary, which is very important, see, of course definitely we will give the 1 mark questions. Okay, so most of the things which will be come from the terminologies, don't bother about those things. Okay, everything we will give. So fast, ma'am, where are you from? Okay, I will tell. I will tell. Basically, I'm from Karnataka. My introduction is that I'm myself Swarnashri. I'm a nursing educator, nursing tutor, and I'm from Karnataka basically. If you want any doubt in Kannada, if you know Kannada, you can ask me in Kannada also. I can speak and I can clarify you. If you want to speak, like I can understand Malayalam. പക്ഷെ സംസാരിക്ക് വരുന്നില്ല ഐ ക്യാൻ മനസ്സിലാവും സോ ഐ ക്യാൻ അണ്ടർസ്റ്റാൻഡ് ഐ ക്യാൻ give you answer in English. No issues. If you want to comment in Malayalam also, comment. I will understand and I will give a doubt clarification. Okay. So the next thing is that we need to. Shall I start? Shall I start the class? One second. Video valla. Aha. Okay, should I start our session today? Uh, Everything will forgetting before exam. No. All right. So everything will forgetting before exam. So for that reason, I will give some tips. Okay. So what are the tips? Are that 4R? Okay. So as a nursing student, you should follow 4R. What is about this 4R? 4R will going to be tells. First you have to read it. Okay. After that you have to revise it. Okay. After that what you have to do? You have to first one is read the things. After that again revise the things, and the third one is that again you want to recall it. Okay. Fourth one, whatever the study thing, again you have to recycle all this phases. Okay. Again you needs to read it again. Okay. So read again and again you read, practice thoroughly, so that will make sure you to understand better the concept, and it will make sure you to so get set go. Somebody is telling get set go. Yeah, definitely we'll go with the class. Okay. So we will first start with our nursing foundation. It is a very vast area that you should cover. So don't get any kind of fear. You can cover it off because you are studying, right? You are taking classes, everything will be there. So don't worry about those things. So today the foundation, we have the syllabus. Okay. So in this particular syllabus around we have 10 chapters. Okay. So 8 chapters mainly we have in first major part, and after that one session will be there. There's a separate part will be there, that is what first aid. So when it comes to the first aid, again we have 3 more units will be going to be covered. Okay. So that is the thing which will be there in this particular subject. Okay. Let us start our class regarding the foundation. When it comes to this one, we will go with the first unit, which is introduction to nursing. Okay. So introduction to nursing. Introduction to nursing. Okay, when it comes to this particular subject, this particular unit, mainly we are going to study about the definitions, terminologies and the concept, meaning, whatever the meaning will be there, and the scope and the functions of the nurse, and history of the nursing in India, and nursing as a profession, how it has been evolved, okay, in the previous how it has been, and now how the advancement which is there, all those things we are going to be study, and nursing professional qualities and preparation. Okay, what are the qualities which will be there in nursing professional, and the preparation also we are going to be see in this particular unit. Okay, so when it comes to the first unit, only the major general topics, okay, the general things regarding the nursing. Once you are joined to your course, right, once you join your course, you choose a nursing, by the time you don't know what is nursing also. So when it comes to that, if you are you come to the actual era, by starting itself we have to go with the very basic key concepts, right? So like that only we are going to moving towards this particular unit. Okay, the terminologies you are going to study. What is nursing? Nursing is a systematic process of providing care to an individual to prevent, to promote and to provide a quality and holistic care to the individual to satisfy the needs of the patient. Okay, so these are all the things. Okay, these are all the things. While once we are telling, by the time you are not able to understand, by studying you can able to be go with this particular unit. It is very easy also. You can expect like a 4 marks question, concepts of nursing, or else what is nursing, 1 mark question you told, no, what is nursing you should tell, like that. So that you can expect. So and the next thing is that you can expect like meaning will be there, that is 1 mark will come, and nursing as a profession, certain key concepts they will ask from that, and professional qualities of a nurse. Okay, so will the evaluation of paper be, one second, will the evaluation of paper be gentle? Do we need to write all 40 pages something? See, that I will discuss in the last sector. Okay, so many peoples are having the so many doubts regarding the evaluation and writing pattern and all. Today only I will tell you. Okay, don't worry about that. I will give you that comment. Okay, whatever you have the doubt inside you, kindly go through the comments. Next we can go with that. Ethics in nursing. In the same unit we have to follow the ethics in the nursing. Okay, certain ethics we have to be follow. Okay, so ethics is a conduct, behavior. Okay, so you have to follow certain ethics in the nursing. Okay, how you are going to be get a proper care, how to provide a care, you should follow certain ethics. Okay, so certain ethics like autonomy will be there. Okay, all the things that ethics you should be like taking self decisions. Okay, by your own self you have to take certain decision in the certain situations. That and all will be the important concepts in ethics, so you have to focus on that too. And the nursing roles and responsibilities of a nurse. Okay, so this is very important topic. Why I am telling about this one? So this will going to be roles and responsibilities. So those are very important. Why? Because she acts as a educator, leader, and she acts as a trainer, teacher. She acts as an advocate. She acts as a, what she will be then? She is a educator, leader, trainer, advocate, and she will be act as so many roles are there. Okay, performing by the nurse. Especially majorly she will be acting as a manager. Okay, she will manage the thing. Okay, all those things, lots of roles and responsibility will be there. Rehabilitator. Okay, so rehabilitator Okay, what is this rehabilitator? Rehabilitator in the sense she can bring back the health status of the patient. Okay, so that is the thing. So that role also she can able to follow. When it comes to the advocate, she is not an advocate, but she will be in some kind of things. She plays a advocate role also. Okay, so that is how you have to write the role of nurse. Okay, so the next we can move with the things like healthcare agencies. Okay, when it comes to the healthcare agencies in the same unit, okay, in the introduction only we have this one, healthcare agencies. Okay, in detail we can go with today's class. So, healthcare agencies are the agencies which we can provide qualitative and quantitative care to the patient in a different kind of sectors. Okay, when it comes to that one, we are going to provide in the hospitals. Okay, the hospitals and community services will be there, and the types of functions of the hospital and the health team. Okay, this is very important. Again and again, I am telling this concept is very important. Healthcare agency. See, so here we have government and the private agencies also. Along with that we have hospitals. Okay, so hospitals, clinics, and community health centers. So okay, all these things will come. Along with that we are going to divide that one in a like government agencies and the private agencies will be there. Okay, so like this we have to write in the examination also. And one more key concept we have to look inside this. Okay, so the functions of the healthcare agencies. Okay, the functions of the healthcare agencies. Okay, especially when it comes to the hospitals, we have to provide a qualitative and holistic care to the patients for the healthcare related problems. Okay, so like that only we are providing immunization facilities in the maternal care. Okay, so in the maternal health centers we have to provide that one. Okay, community health centers only taking major part of immunization role. Okay, now all nursing students are doing pulse polio duties and all, right? So why you people are doing to immunize the younger generation, right? So all these things which will be, see, for learning we should not sit and mug upping. Okay, we can see by observing some things and understanding better way, we can able to understand the things in a very easier. Okay, so like that only you can write the functions. Okay, don't forget to study the functions. Again I'm telling, don't forget to study the functions of healthcare agency and the types also, and health team. Okay, so the next important topic is that health team. So when it comes to this one, it is one of the high 5-star we can give for this. So when it comes to this particular topic, health team members will be there. So chief medical officer will come, medical officer will be there. After that physician will be there, staff nurse will be there, and we have nursing superintendent, like staff nurse will be there, pharmacist will be there, lab technician will be there. Okay, housekeeping will be there, clerk will be there. Okay, in the entire hospital who all will come, and regarding their discipline you have to write in the exam. Okay, so in this particular unit this much questions also covered. The next one, modern approaches to nursing care including the holistic nursing care and health and disease, definition of the health, determinants of the health status, basic human needs, illness and effects on individual. Okay, so we majorly we are going to cover regarding the difference between the health and the illness, Okay, so when it comes to this one, this is also one of the very important topic. You should know the determinants of the health, and you should know the what is meant by health. Okay, and what is illness. Okay, so that is all you have to focus more in this particular unit. Okay, and important thing, see, you do one thing. Yeah, first year GNM. Somebody else commented GNM first year, no, GNM first year only. Okay, So listen, this is the things which you have to study in the first unit, okay? Health determinants and functions of each and every members which will be present in the healthcare team, and the functions of the hospital, types of healthcare agency, okay? See, why I am going slowly, you have to take one paper, pen, whatever the key concept and the important things I will tell, then and there itself you can write it off, okay? So that will make sure you to get a good marks in the examination, okay? So and here also we are going to cover the basic human needs, okay? The basic human needs, what is the basic human needs will be there, physiological and physical needs will be there, okay? So all the basic human needs, food, shelter, okay, air, nutrients, okay, for example, these are the examples, okay? So along with that, health is also one of the basic need, okay? You have to be healthy. So major key concept you can write it in this, okay? The next one, we will go with the next unit, nursing care of the patient, okay? Next unit, unit number 2. First unit clear, no? Any doubt is there means kindly chat. Shruti ma'am where? Ma'am will come. First chapter clear means kindly put a message. If you want any doubt in that particular, you can comment over here. I will clarify that, and then we can go with the next unit, okay? So I'll give 2 minutes, you can go with that, okay? Any doubt is there? So the next unit we will go with the nursing care of the patient, okay? So this is the major and foremost important topic in the nursing. You have to provide a care for the patient, okay? So certain modalities you have to understand in this particular thing. So that is the thing, you have to go with the complete care modalities, okay? So that is what you are going to be study, okay? Therapeutic environment, providing how you need to provide a care to the patient and how it will be impact on the patient health status, okay? That is the entire thing you are going to be studying this particular unit. Now I will tell patient environment in the hospital patients unit, okay? So how the patient environment should be there in the hospital unit, okay? So Florence Nightingale given a theory, it is environmental theory, okay? So our environment is also matters a lot. It is one of the key concept to get our health back, okay? So our environment should be clear. Best example I will tell, if your home will be very messed, your mood will be also messing only, okay? The same thing when it comes to here also in the environment, we are providing a proper, comfortable, calm and very good environment to the patient. So we can expect the same kind of result in the patient care, okay? So the satisfaction care we are providing to the patient, definitely we will get the result also will be curative, percent will be more, okay? So the next, healthcare agencies, yeah, healthcare agencies I have written, no, that I will tell you, okay? Once again I will tell you, the hospital, clinics, rehabilitative centers, community health centers, okay? Which and all the services which will be provided in the community health services, okay? Maternal health services we are providing, and child health care, child health services, okay? And psychiatric hospitals also, okay? These are the healthcare agencies which will be comes under the healthcare agency, okay? The next thing we have to focus on, government agencies and private agency will be there, okay? So the next you have to go with the second unit, again we are continuing therapeutic environment. In that, the therapeutic environment, physical factors, lightning, temperature, ventilation, humidity, noise, safety needs and prevention of environmental hazards, and psychosocial and aesthetic factors we are going to be see. Ma'am, sound kekunilla, sound illa, wow, sound is coming, okay? So in the second topic of this unit. Mainly we are going to focus on the therapeutic environment. Therapeutic means what? The treatment. Okay, the treatment what we are providing to the patient. By the time we have to provide a proper environment to the patient to bring back their health status. Okay, so their physical factors will be important. Okay, so hospital should have the proper lighting. Okay, proper ventilation. Okay, the common basic things which will be provided correctly, then only they can able to secure a good health. Okay, humidity, noise and safety needs and prevention of environmental hazard. Okay, we have to be take care of safety needs and as well as the prevent the environmental hazards. Okay, the next one is psychosocial and aesthetic factors. Okay, we have to provide a proper calm and like it will be enhancing our psychosocial sector also, factors also. Okay, so that is why we have to maintain the environment of the hospital should be correct. Okay, the next one is we have patient's adjustment to the hospital, understanding patient as a person, socio-economic and cultural background, health status, etc. Effect of hospitalization on patient and family, admission, transfer, the procedures. Okay, so in this particular sector, each and everything you are going to study, there we are going to study about the admissions, okay, and discharge. Okay, how you have to admitted to the hospital, the patient has been admitted, what are the things which we are carrying. Okay, by the time assessment we will do. Okay, all the nursing process which will be comes here, assessment, diagnosis, planning, implementation, evaluation, all this process, and after that we are providing a care to the patient. After that one more thing is there, that is discharge. Okay, so the discharge will be there, types of discharge, each and everything you are going to study in this particular unit. Okay, the next one is effect of hospitalization on patient and family, admission, transfer, here also. Okay, the effects. Okay, if you are going to the another place, there may be a chance to be like feeling uncomfortable, you are not feel comfortable. Okay, so that will be majorly impact on the patient's health status also. So for that reason, in this particular unit only we have to keep on monitoring on the environmental factors. Okay, so that is the thing you have to focus. The next one is basic nursing skills. Okay, so like communication is a very very key concept. Okay, so you have to understand thoroughly regarding the communication. Why? Because if you are not communicating properly, okay, so there may be one of the barrier between the nurse patient. Okay, so you can't able to maintain a good rapport with the patient. If you are telling something, the patient is not understanding, by the time there may be a changes in the care. Okay, so the modalities will be changed. For that reason you have to maintain proper communication. So write the communication you can expect in the 1 mark. The next one is nursing interview, record and reporting. This is also one of the very important nursing interview sector and the record reporting. When it comes to the record and reporting, whatever the things you have to do for your patient, whatever the care you are rendering, each and everything should be recorded. You should not going through that simply you can't leave. Okay, whatever you are done, if you are checking one GRBS also, you have to record it and you have to report it. By if any kind of consequence which will be happen, by the time we can definitely go and we can sort it out, right? So if you are not doing such kind of things, definitely it is going to be affecting. Okay, so these are the things you have to focus. And the next one is in this particular unit only, the nursing process. Okay, so in this unit only the important sector is nursing process. So next, when it comes to the nursing process, here the important is what is nursing process, meaning you have to know. Okay, so it is one of the systematic process while providing the care. Okay, it is having certain steps. Okay, it is having certain steps that we can discuss: assessment, okay, diagnosis, planning, intervention, evaluation. Okay, so that the next one, that is the things which will be there, and evaluation and the nursing care plan, that we can discuss now. So we will start with the first one, assessment. So all these things you have already studied. Okay, after that, diagnosis. After that, planning. This is very important. The next one, we are going with the implementation. Next one, we have evaluation. Understanding. So this is the nursing process. Steps will be there. The first and foremost in the assessment, we are going to collect the history of the patient. Okay, so in a very minimalistic way I will teach you, understand. Okay, so based on that you can explain in the answer. Okay, you can explain in the examination. See here, once it will come, assessment means we are going to collect the data, collect the information from the patient to know what has been happened to that particular patient. Okay, so for that reason we have to collect, right? But see, someone will come, patient will come to the hospital. By the time if you are not getting any kind of information, why we are collecting the baseline data? So for furthermore studies which will be acts as the basic, okay, the basement, it will be acts as a basement. For that reason, assessment, okay, in the assessment we are going to collect the information or the baseline data regarding the patient. Okay, so the first step is finished now in the nursing process. Okay, so this is the first step. Any doubt? Good evening ma'am, please discuss about long answer question 7 mark. Yeah, we will discuss at last. Okay, this complete class you listen. The next thing is that diagnosis. When it comes to the diagnosis, it is one of the screening method. Okay, so don't be confused. Diagnosis means what has been happened. For that reason we are using this one. We have to go with certain screening test. Okay, and as well as we are going to do certain important test to know what has been happened to the patient. Okay, understanding I'm telling. See, if anybody is there in Kannada, so I can explain in Kannada also. ಪೇಷಂಟ್ಗೆ ಏನಾಗಿದೆ ಅಂತ ತಿಳ್ಕೊಳ್ಳೋದಕ್ಕೆ ನಾವೇನು ಮಾಡ್ತೀವಿ ಅಂತ ಹೇಳಿದ್ರೆ ಕೆಲವೊಂದೊಂದು ಪರೀಕ್ಷೆಗಳನ್ನ ಮಾಡಿಸ್ತೀವಿ. ಫಾರ್ ಎಕ್ಸಾಂಪಲ್, ಐ ಕ್ಯಾನ್ ಟೆಲ್ ಯು ದ್ಯಾಟ್ ಲ್ಯಾಬೊರೇಟರಿ ಎಕ್ಸಾಮಿನೇಷನ್ಸ್ ವಿಲ್ ಬಿ ದೇರ್, ಅಲ್ಟ್ರಾಸೌಂಡ್, MRI, CT. ಬೇಸ್ಡ್ ಆನ್ ದ ಪರ್ಟಿಕ್ಯುಲರ್ ಪ್ರಾಬ್ಲಮ್ ವಿ ಹ್ಯಾವ್ ಟು ಗೋ ವಿತ್ ಸರ್ಟೈನ್ test, important test. Okay, so that is the things which will be taken in the diagnosis phase. Okay, understood? No. So the next we can go with the planning. Now we have come to know what has been happened. Okay, after diagnosis report will come, means we come to understand that the problem is this. Okay, so next step is that for the problem we are going to do the planning. Okay, so plan what we have to do. Okay, see, before going to plan for, like before going to any area or any trip, we used to have some plan. No, same like before going to provide any kind of care, here the planning acts as a major step in the nursing process. Okay, so the next one is that we have go with, after the planning we plan the care that we are going to be implement. Okay, so the planning which will be called also as intervention, action. Okay, so that like we are going to be implement that action what we have planned. No, we are doing here implementing. Okay, so that is the thing. Next one is evaluation. After providing all the planned care, after the implementation we are going to be evaluate that whether the patient has been overcome from the problem. Assess, like evaluation means if you write the examination, after that teacher will do the correction, right? So that is the thing we are going to do here in the evaluation. Okay, so hope you guys are understood. When next one which will be nursing care plan will be there. That and all already you know how to write the care plan and all. That is a very that is also one of the very important. If they may ask the any kind of disease condition, here also you can write it down. Okay, clear now second unit. So here we are expecting nursing process is one of the very important question in the examination, and we can expect like physical factors of hospital environment, therapeutic environment, or also we can expect that what we can expect, admission and discharge procedure we can expect, and basic nursing skills 1 mark question for sure you can expect the communication. Okay, so communication is also one of the very important thing. So let us chalo with the third unit. Shall I move to the third unit? Hospital type and function is important or not? Very important. Hospital type and function, once you study only, then only move to the next topic. That will make you to understand other topic also easier. Okay, if you know better the functions, better the types, definitely you can answerable for other things also in this particular unit, right? So that is also important. Okay, next we can move with the third unit, meeting the basic needs of the patient. Okay, so again the basic needs will come here. We have physical needs, hygienic needs, and elimination needs. Next one is nutritional need, psychological need, and care of terminally ill and dying patient. This and all already we have discussed in our previous session for post basic. Again I will tell you. Okay, this one is very easy to know. Okay, physical needs. Okay, the basic physical needs will be there, no? So the comfort, rest, sleep, exercise, those are the basic physical needs. Okay, in that you have to know most of the things which is body mechanics. Okay, moving, lifting, and transferring of the patient, that you have to know. And in that next one is position. Okay, types of position, supine position and all will be there, no? So that you have to study thoroughly. And the postures, maintenance, and the comfortable devices. Okay, so the comfortable devices you have to study thoroughly. And beds and bed making, type of beds, type of bed making, open bed, closed bed, everything will be there, no? Pre-operative bed. So all the things you have to study in this particular physical needs. Okay, in the third unit. Third unit is going to be tells about the meeting the needs of the patient. So when it comes to meeting the needs of the patient, that you should already we know that physical needs, psychological needs, hygienic needs, okay, all those things have been already told. Okay, in that also important points I am telling: bed making and the bed making procedure you have to study, and types of bed making. That is one of the longest form of question, okay, from this unit. Next one, hygienic needs, personal and environmental hygiene, personal. And the next one is nurses note maintaining and environmental hygiene, care of eyes, nose, ears. Okay, personal hygiene, whatever it will become, no? Okay, all those things which will be there. And next one is care of mouth, skin, oral hygiene. Okay, personal hygiene, you take personal hygiene completely, you can go with that. Oral hygiene will be there. Okay, how to wash the hair, and for unconscious patient and all, which will be there, no? For maintaining, that is what one of the hygienic needs. Okay, whether the patient is conscious or unconscious. If the conscious, the patient will be taken care of by their own self. Okay, so there is no demand of self-care deficit will be there. When it comes to the unconscious patient, we need to provide partially, we need to we have to directly we need to provide to the patient. Okay, we can't able to tell them to do by yourself, we can't tell like that. Okay, in such a way we can't able to tell. For that reason we have to meet the hygienic needs in nursing practice. You have to do all this personal hygiene and environmental hygiene, and as well as we have to provide the personal hygiene procedure to the patient. Okay, so the next one is elimination needs. When it comes to the elimination need, the problem constipation, diarrhea, retention, or incontinence of urine will be there. By the time we have to provide a particular procedures like administration of enema and all will be there, no? So that procedures you have to study here. And bed offering bedpan and urinal, see, all these things are the procedures. Okay, in this particular unit we are going to mainly discussing on the all the procedures. Catheterization will be there, how to how to do the catheterization, how to remove the catheter from the patient, each and everything you have to write over there. The next one is maintenance and maintenance of the input and output, especially when it comes to the severe and serious critical conditions we are administering the catheter. By the time you have to maintain the output, intake and output chart. Okay, so that is monitoring is one of the very important. Okay, here we are going to hygienic needs also over, elimination needs also over, right? right? So, and in this you have to know what is the role of nurse to attain these goals, okay, to attain reach this needs. Okay, the next one is nutritional needs. Nutritional needs, diet in health and diseases, factors affecting the nutrition in illness, and the role of nurse in meeting patients' nutritional needs. You already know that, only regarding the food. Okay, so the food will be highest thing, like major part in the nutritional needs. What kind of diet planning will be there? Okay, so when it comes to the nutritional needs, so here menu planning and diet planning will come. So the menu planning and diet planning, we are going to be, see, first and foremost you should know that food will be acts as a very good essential component to cure the health. Okay, so food will be the medicine, medicine will be the food only. Okay, if you are not taking properly food, water and all, by the time definitely you will get the disease condition, right? So for that reason you have to maintain your nutritional balance, otherwise it will be like a imbalance of the nutritional status of the patient, one of the nursing diagnosis, right? So you have to overcome from that, means you have to thoroughly know about what kind of food you have to be take, and meanwhile what kind of food you have to be provide to the patient according to their disease condition. Okay, modification of diet in illness, diet planning and serving, and feeding helpless patients, including artificial methods of feeding, okay, so these are the things in the nutritional needs. Okay, so when it comes to this one, you are going to attain the nutritional need of the patient, you have to see here. And the menu planning according to their disease condition to cure their illness. We have, suppose hypertension, diabetic diet will be there, antenatal, postnatal, certain different kinds of diets will be there. Okay, that you have to thoroughly study and write in the examination if they are asking. Okay, so the next one we can go with, hope you understanding, right, whatever I am telling. If you have any doubt, comment over there. If you can't able to provide a sufficient nutrition to the patient, by the time we have to feed them. Okay, so artificial, through the process of artificial feeding you can able to feed. Okay, we can insert the NG tube and we can promote the artificial feeding. Okay, so the next one is psychological and spiritual needs. When it comes to this one, role of nurse is very important, and recreational therapy, and these are the things you are going to be study. The last point of this unit is care of terminally ill, dying patient signs and symptoms you have to study, and the needs of the dying patient and the family you have to confirm to the patient family members. Okay, and you have to, if any kind of things which will be there, by the time you have to inform and you have to take the consent from the family members of the patient, and whatever the signs will be there during the dying, that you have to study. The next one, nursing care of dying patients, special considerations, advanced directives, then will dying declaration, organ donation, all these things, and medico legal issues, care of dead body, care of unit, autopsy, embalming are the things. Okay, so again here you can expect autopsy as a 1 mark question. Okay, so these are the things you have to focus in the third unit. Okay, third unit clear, no? So shall I move to the next unit? First one is in the fourth unit we are moving. In that assessment is the fourth unit. Okay, so the fourth unit is assessment. So any doubt in the last unit? Hey, don't worry about important questions at last, definitely I will give. Okay, when it comes to the last session, definitely you will get the important questions same like a previous year, previous classes. Don't bother about that. Little bit I am going detailing. Why? Because this is one of the vast and important subject. Okay, so we can't tell you guys that you know this one, let it finish it off. Okay, you can't, you should not, we should not able to do that. Okay, so for that reason I will go a little bit faster, and like slowly I will take, but each and every unit I need to complete. Okay, so why? Because you should know at least what it is there in this particular unit. Otherwise you may feel that what you will feel, somewhere I saw this topic, I can't remember. Okay, people are messaging here, no ma'am, I studying but not remembering or recalling anything by the time of examination. That will be happen. So for the, at least you should know the topic what it is. If you are not having a proper uh, what we can tell, if you are not knowing the proper answer during the examination also, at least if you know the meaning of that, you can write something else, na. So for that reason, the next one is assessment of patient or the client. That is the next unit, physical assessment. Okay, so physical assessment, see, first the patient will come to the hospital. Assessment is the subject which we are doing. Should I continue? So assessment is the first step we are going to be do in the hospital. When it comes to the physical assessment, we are going to assess the physical gesture posture of the patient. Okay, first we will check the height, weight and posture of the patient, and head to toe physical examination we need to do. The next one is physiological assessment. When it comes to the physiological assessment, we are going to thoroughly knowing about the vital signs. What are the vital signs we have? We have temperature, blood pressure, pulse, and we have oxygen saturation, and as well as we have a pain is also one of the vital signs only will come there. Okay, so all these things we are going to be studying in the assessment. Okay, this one will be physiological. First one is physical assessment. Okay, so physical assessment, physical. The next one is physiological. So to know the proper body functions and all, we have to go with this normal and abnormal characteristics, factors influencing the variations, observation and collection of specimens, urine, stool, vomit or the sputum for the diagnostic procedure. Okay, the next one is psychological assessment, mood, intelligence, emotions and the abnormal behavior of the patient. Now I will once again talk about this assessment. Okay, so this is the fourth unit of the assessment. So in that unit, first one is physical assessment. Physical assessment, we are going to check the height, weight and posture and gesture of the body, and again we are going to do the head to toe examination, physical examination we used to do. You are writing in the care plan now, that we are doing here. Okay, the next one is physiological. When it comes to the physiological, we are going to find out the abnormal characteristics through assessing the vital signs and other diagnostic different evaluations. Okay, so that you clear, right? Next one is psychological. Okay, psychological. Okay, when it comes to the psychological, we are going to assess the emotions of the patient and intelligence of the patient, mood of the patient, okay, or any abnormal activity has been done by the patient. These are the things which we are going to be done in the fourth unit, that is in the psychological assessment. Okay, that we are finished. Okay, fourth unit has been finished. There these three key concepts are very important, and the diagnostic test also here important, what you are going to be do in the physiological assessment. Okay, so all these things are the and the characteristics and factors affecting to imbalance in the vital signs or any other physiological assessment. Okay, if you find out means that you have to write. Okay, that is the important part in the this unit. Next we can move with the infection control. Okay, so infection control is also one of the very important topic in the nursing foundation. Okay, as a nurse you have to know thoroughly. One second, if you have any doubt about this, you just write it down. Okay, so infection control. I told you, no, infection. What is infection? Infection itself, we come to understand that there is a presence of microorganisms. Okay, so the next unit is infection control. Okay, should I faster? So yeah, infection control. Very first you have to know about the things that which is very important in the infection control. We come to know what is infection. Infection means there is a presence of the microorganism or else any kind of bacterial activity or any presence of the viral activity which will be there present. Okay, so that we will call it as a infection, presence of the microorganism. Okay, so this infection, whether infection is good for health? No, right? So in order to prevent this one, certain controlling measures has to be taken by the healthcare facility members or healthcare facilitators, or in the common era of life also we need to be prevent the infection. We have to be, prevention is better than cure. Okay, so for that reason you have to prevent the infection. Okay, understood. The next one is infection control. The nature of infection you have to understand. The next one is chain of infection transmission. Okay, how it is going to be transmit, host, from the host how it has been transmit to the. Okay, so all those things you have to be study. The next one is defense against the infection control. Natural and acquired defense will be there, and hospital acquired infection. Okay, so that is the very important. So you should know hospital acquired infection. Hospital acquired infection. This is also one of the very important, and they will ask you as a nosocomial infection. Nosocomial infection. Okay, so they will ask nosocomial infection again and again. I am telling, in the 1 mark question they can ask, or else they can ask in the short notes also. Write about the nosocomial infection. Okay, so what is this nosocomial infection? We come to know by here itself, hospital acquired infection, right? So hospital acquired infection, by through the entry of this hospital only we are getting the infection. Because of the hospital only we are getting the infection. So that infections are making us to suffer with certain disease condition, that will be called as a nosocomial or the hospital acquired infection. If they are asking about like nosocomial infection or the hospital acquired infection, write the same answer. Okay, so the next we are going to know about the concept of asepsis. Okay, so here now, so the sterilization is also one of the important things. Sterilization. So sterilization and the disinfections are the two methods to clean or clear the infectious agent on the surface or the environment. Okay, so the sterilization, which is one of the method, and see it will comes under the sepsis concept of asepsis only. So we have medical and surgical asepsis. In the surgical asepsis we are following this sterilization, and another one is disinfection also we will follow for certain things. Okay, so disinfection and the sterilizations are the two major important methods to clear the infection or infectious agents. Okay, so one by one we can talk. For 1 mark they can ask what is meaning of the sterilization, meaning of the disinfection. Okay, so that is also one of the important question. So keep it, write it down. And the next one is we have to go with the sterilization. We have certain methods like autoclaving method and all will be there. Okay, so to sterilize the thing. Okay, so the next one we have to move with the sterilization. Here 100% we are going to kill the microorganism. What I am telling, understanding? In the sterilization 100% we are going to kill the microorganism including their spores. Okay, so including their spores we are going to kill the microorganism. There is no regeneration or the regrowth of the microorganism is not possible in the sterilization. Understood? The next one is, will you take all subject classes? Yes, we are taking all subject classes. Yes, till your examination, we are taking all the subject classes for all the year. Okay, not for only for the GNM first year. We are taking for all year. Mm. The next one is disinfection. Here what it will be happen, students, listen, 99% of microorganisms are going to be clear, but there we can't able to clear the spores of the microorganism. Okay, the next one you have to go with the hand washing techniques. Okay, the 7 steps will be there in the hand washing, so that you have to thoroughly study. And next one is you have to study both the hand wash, surgical hand wash and the basic hand wash you have to study. The next one is isolation and personal protective equipment types, uses and techniques, wearing and removing. Okay, so this one I will explain now. Okay, so for here, personal protective equipments, hand washing already I told, no, the steps you have to study thoroughly, surgical hand wash and the medical hand wash, there is nothing difference will be there. Okay, so the basic hand wash we will do till the wrist, and surgical hand wash we will do one more step will be add, and the duration will be different. Okay, so for this 2 minutes will be there, for this it will be around 5 minutes we used to do the surgical hand wash. Okay, so minimal for basic hand wash in 30 seconds only we will finish it off, but when it comes to the surgical hand wash we have to go with the 5 minutes or more than 3 minutes we need to do. Okay, so like that kind of small difference will be there in the steps also, so that you have to thoroughly study. Okay, so the next one is, because there is a certain difference in the surgical and the basic hand wash. Okay, so for that reason, okay, so you know already that procedure that I know, so that is also one of the 5 mark question, like a short note kind of question. And next we can move with that we have a personal protective equipment, that is what, PPE. Okay, so you can see this is what, personal protective equipments like mask, glove, gowns. Okay, so all these things which will be there, and you have to thoroughly know about how to wear the gloves, how to remove the gloves. Okay, so both the procedure, while wearing and while removing, both the procedure will be there for the personal protective equipments, you have to do that. Okay, cap will be there, okay, head cap will be there, that and all, mask will be there, glove will be there, gown will be there. Okay, all these things you have to be study in the personal protective equipments. Personal protective equipments are the equipments to provide a protection against the infection for the healthcare facility members as well as the patient also, to curb the spread of the infection from person to person. Understood? To maintain the sterility also. Okay, so if you have any doubt, please discuss that at the end of session. Do we need to write all the question in the order? So it's okay to write now and essay answer first. Okay. I will go through like first long go with the 1 mark questions. Okay, so like that we can short notes answer the following and all we can discuss. Don't worry about that. The next one is decontamination of unit and the equipment, that is again it will come the sterilization only. The next one is transportation of infected patient, standard safety precautions, transmission based precautions, biomedical waste management. Okay, so this is also one of the very important here, the biomedical waste management, BMW we will call. Okay, so it is not a car, it is a biomedical waste management. You have to thoroughly know about the biomedical waste management and their color coding. Okay, so we have a green, yellow, blue, red, black, white color coding will be there. Okay, so according to that you have to do the segregation of the waste in the medical sector, hospital waste management you have to be done, otherwise you will be punishable, you will be pay the fine if you are missing any color coding. Okay, wherever which we are mentioning the particular color only, we need to put the particular type of waste in the medical healthcare sector. Okay, so that is also one of the very important topic. The types of hospital waste you have to study under that one, and decontamination of the hospital waste, segregation and the transportation and the disposable. Hope you clear with this. Okay, now you come to understand the biomedical waste management is also one of the very high yielding topic for the question like examination. Okay, so the next one is therapeutic nursing care. Okay, so this is the 6th unit. Now we are discussing the 6th unit. So the 6th unit, it is going to be tell about the care of patient with respiratory problems, for example dyspnea, and deep breathing and coughing exercises, O2 inhalation, dry and moist inhalation, oronasal suctioning, care of patient with altered body temperature, hot and cold application we have to do. So the next one is we have care of patient with the fluid and electrolyte imbalance, and we have care of unconscious patient, care of the bedridden patient, then care of the patient with pain, care of the patient with the body elimination deviation. Okay, so in this all the things what I told, no, that is the important concepts only. Only the thing I am going to discuss more on fluid and electrolyte imbalance. Okay, fluid and electrolyte. So when it comes to this one, you have to certain things you have to be know thoroughly, the range of fluid and electrolyte imbalance. Okay, so the what is the like we are going to study this various disease condition under this particular unit. When it comes to this particular topic, we are going to know about like hyperkalemia, hypokalemia, hypercalcemia. Okay, all these things you have to study thoroughly, because in our body we have 75% of body fluids will be there. So if any kind of variations which we can see in the imbalance of the fluid and electrolyte in our body, which will be present in our bloodstream, there may be, of course, we will get the deviations in the range of the electrolytes. Okay, that may affect in the name of hypercalcemia, hypocalcemia. Okay, so hyper means increased, hypo means decreased. Okay, so like this, if you are going to know, differentiate and studying, definitely you can go with that. So this is also one of the very important unit. Okay, so don't be confused here. Then pain management. Okay, so the pain management is also one of the eye yielding topic, and the care of patient with the respiratory like ventilation, mechanical ventilation and all you have to focus on here. Okay, O2 inhalation, okay, that and all you have to take care. The next one is next unit is 8th unit. 8th unit we are going with the 7th unit, introduction to the clinical pharmacology. Introduction to the clinical pharmacology, the name they have given, but majorly we are going to be study about the administration of medication. Okay, administration of medication. So here we have to know thoroughly about the administration of medication. Before going to that, I would like to tell that it is not providing the medication. We are the nurses, we are only administering the medications, and we are not having the right to prescribe the medications. Okay, so as a fresher you should know this point. The next thing which we can able to know, the rights of administration of medication. Rights. Okay, we have according to WHO, we have certain rights. Okay, so that we can discuss now. Okay, the very first, right patient, right patient, right time, then second one, third one, right dose, fourth one is right route, right documentation or the evaluations are the major 5 important rights of administration you have to study thoroughly. Okay, So the next one is general principles, consideration, purpose of medical administration, principles like rights, what I have told, no. So that is the eye yielding topic here in this particular unit. Okay. So the next one is broad classification of the drugs will be there, therapeutic effect, side effect, toxic effect of any drug they can ask, and factors influencing the drug action, system of drug measure metric system, and household like fluid calculation all will be there, no. So that you have to do. And the next one is routes. Okay, so I told you, no, the right routes. When it comes to the right route, you have to know like certain different types of medications we are going to be administered in the different routes. Okay, oral means you already know, through orally we are taking the medications. When it comes to the intramuscular means we are going to inject the injection or any kind of drug to the muscle, through the muscle, okay, into the muscle. Okay, same like that. Intravenous means what? We are going to inject into the vein. Okay, the drug which is going to inject into the vein. The next one, what we have? Intravenous, intramuscular, intraarticular. Intraarticular means we are going to inject into the joint space. That is and all advanced. Okay, so same like topical administration will be there, like ointment and all will be there, no. So that you have to apply on the skin wherever you are getting any kind of infection, there you are going to use. Same like that we have certain routes will be there that you are going to be study thoroughly. Okay, while seeing the medications you come to understand this kind of medications, how we through which route we are going to be administered. Okay, so that is also one of the important topic. The next one is role of nurse. Okay, the role of nurse in administration of medications. If you following all these rights, no, that is the biggest role. Okay, because now what it is the error we can see, bias is like right patient. If you have two patients in the hospital sector, like same ward, two patients having the same name, by the time if you have, there is a chance to smudge or there is a chance to change the medications. So that will be the biggest error. If you are providing unnecessary medication to the other problem, that will be again biggest error. So in order to curb that one, you have to follow. That is one of the roles and responsibility of the nursing. Okay, that and all you study by yourself. The next one is inhalation and recording and reporting. The last thing which will be there, whatever you administer, whatever you have done also, you just do the reporting. Okay, so that will make sure you to provide like documentation you have, means you can able to give the answerable. You are the answerable authority for any error will be happen by the time. If you are not writing, means if you will definitely get the pros and cons of that. Okay, so that is one of the things you have to focus. So far we have discussed the 7 units. No, in this 7 units only we are expecting most of the questions for long essay and all. Okay, so next we can move with the first aid. Okay, so little bit fast I will go. Almost we have know about this first aid very thoroughly. So when it comes to here, we have introduction of the first aid, definition, aims of first aid, and we have types of first aid. Okay, so there are certain different snake bite will be there, poisoning will be there. Okay, dislocation, all these things will fall, sudden fall will be there. Okay, so all these things we have a certain different kinds of criteria of providing care at a sudden. Okay, first aid is a sudden intervention of the care. Okay, so that we have to go. The next thing which we needs to go means we are going to study about the rules of general principles of the first aid and the concept of emergency. Okay, and here also we have to know, if you are working in the ward, that will be a different kind of sectors. Okay, so nursing team will be there. So one ward we have 2-3 according to the nurses patient ratio, 2-3 nurses will be there, means by the time we are dividing. Okay, so the division of labor will be there. For certain work the one particular nurse has been assigned, but when it comes to the emergency, each and everything you have to know thoroughly and you have to be fast and furious. Okay, the quick action will be needed. Okay, for that reason you have to be thoroughly study about the first aid. The next one is procedure and techniques in the first aid, preparation of the first aid kit, dressing, bandaging, types of bandaging, and we have to know about the transportation of the injured, and we have to know about the CPR. CPR is also one of the very, very, very important. You should go through that. Don't skip this point. Okay, the next one is first aid on emergency like asphyxia, wound and bleeding, and injuries to the bone, that is dislocation or any kind of things which will be happen, muscle fracture, spasms. Okay, so all these things you are going to be study in the first aid. Okay, so next one is community emergencies and community resources. When it comes to this one, fire explosion, floods or any kind of disaster which is like earthquakes and all, tsunami, phenomena, and we have that recently we have the plane crash and all, so that kind of emergency will be there. That means there is a large group of people are affecting. By the time, what kind of care you have to provide in the first aid, that you have to study in this particular fourth unit in the first aid section. Okay, then role of nurses in disaster management and the rehabilitation. Disaster management, the phases will become so the primary phase and all will be there, that is very important. Go through that. So that is also one of the. Then we have to know about the policies. Ambulance services. Ambulance means what? Mobilize. Okay, to mobilize, to transfer the patient from one place to another place, we need one channel, right? So that is then voluntary agencies, local, state, national and international, NRI and all will give a fund. By the time they used to provide a care by themselves. Okay, so we have to take the help from them and all. So all those things you are going to be studying in this fourth unit of the first aid. I hope you guys are clear with all the units. Okay, now you come to an idea that whatever the units which will be there, understood? No? So this is all about the syllabus review of the nursing foundation. Okay, next we can move with the question paper review. So this question paper review, everybody are waiting for this only, so don't skip this session. Now it is a very, very, very important thing you have to know. Okay, so I will go through first long essay. Before going to that, I will explain the question paper, how it will be there, that I will explain. Already we have explained in the last live sessions and all, but even more once again I will explain, because this is one of the very, very important subject to study in the nursing. So total we are going to write for the 75 marks. Okay, so in this 75 marks we are having the sessions like meaning for the following. Okay, so write the meaning of the following. 4 questions will become. Okay, so first main you are going to write the meaning. Okay, so in the meaning you are going to be get 4 questions, each question carry 1 mark, so total 4 marks you are going to gain here. Okay, clearly you listen. If you have any doubt, should I continue question paper analysis? Can I go with this question paper analysis? So now you do one thing, take one pen and paper. Okay. Anyone can put a comment in the comment box. I will go. Okay. Okay. So we will go with this. First one you understood, right? So meaning 4 questions will be there. Each question carries the 1 mark. Okay. So the next one is we have fill in the blanks. Okay. In the second main we have fill in the blanks. So fill in the blanks type of questions. Again we have a 4 question. Each question carries 1 mark. Okay, 4 into 1 is equal to 4. So the 4 marks again we are going to be carry. See, if one statement they used to give, in that statement we need to answer one space they used to give that space we need to fill. Okay, so that kind of questions they are asking. So that is 4 questions we are going to get. The next one is write a short note on any of the following. So this is one of the high yielding factors in the question paper. Third main. Okay, third main, short note. So in the short note they are asking any 4 questions, 5 questions they will give. So 4 questions we need to answer over there. Okay, so in that 4 questions now I will tell how it will become. So 4 questions will be there, each question carries 4 marks, 16 marks we are going to be get here. So but they will give the 5 questions which is appropriate for you, which is suitable for you. So that question you use it. Okay, so that will make sure you to like you will know properly the answer, means if you are able to write that one. If you are not knowing, simply you will choose that particular question, again you may stuck on in between the examination. So in order to avoid that one, you thoroughly study the question paper once the invigilator will give the question paper, right? So for that time you just study over it. The next one we have answer the following. Answer the following. Here we have 5 questions will be there. So fourth main is answer the following. Answer the following. So here 5 questions will be there. So there you have to answer 5 also, but marks will going to be differentiated. 2 question carries 6 marks. So when it comes to first 2 question, 2 plus 4, total 6 marks for 2 questions. The next one remaining 3 will be 2 plus 2 plus 4. Okay, so again we have here 8 marks. Okay, 2 questions for 6 marks, 3 or 4 3 questions for 8 marks. Okay, so like that totally we are getting here from this main we are getting 8 plus 6 10 14. Okay, so the total 14 marks we are going to get over here. Okay, so this is one of the long essay type of questions these are. Then again we have a short true or false. Okay, again we have true or false. Okay, so here we have a 4 questions carries 1 mark. So 4 marks we can get. Okay, so total 4 marks we are getting. The next one we have that write the short note. Again short note will be there. So that short note we have any of 3 we need to write 5 marks. Okay, 3 questions will be there, 5 marks will be going to get. Each question carries 5 marks. So 15 marks for again 3 short note. Okay, so total 15 marks. 3 question, 4 question they will give, 3 you have to write, any 3 they will ask. Okay, the next one is answer the following. Again here 10 plus 6, 16 marks you are going to be attend in this particular main. They will ask 4 questions togetherly take 16. Okay, last one will be asked for the 6. This will be vary sometimes. Okay, according to the question intensity of the question they will increase or decrease the mark. Total we are getting the 16 in the answer the following last main. Okay, in the last main we are getting 6th main, this is 7th main. So in the 7th main we are getting the like 16 marks will be the weightage of the marks of the particular session is 16. How many marks want to pass? You tell me how much marks you want to secure. How many marks you want to be get? Fastly comment down. I want to know. Right. Prarthana. How many marks wants to pass? How much you will take also you will be pass? No. So you have to work. See, I know certain marks will be there for passing, but why I am telling, if you stick on to 100 you will reach 80. If you stick on to 80 you will reach 60. If you stick on to 60 you will reach 30. Understanding? So I will tell at the last. 40 marks you want to take, Atul? 40 marks for passing, yeah. 38 to 40. So, we will go with the important questions. First, we will go with the long essay. So, first one is hygiene. Define hygiene. Now, you take down hygiene. Define hygiene. Define hygiene. Explain the factors influencing maintain the promotion of health. Okay, what are the factors which will be influencing to promote the health? Environmental, okay, the therapeutic, environmental and all will be there. No, hygiene needs, nutritional needs, okay, or psychosocial needs, physiological needs, all those things you have to include here and write the answer for the long essay. First one is define hygiene and explain the factors influencing to maintain a promotion of health. Okay, so that is the important question. The next one is again in the long essay, take down define oral hygiene. Define oral hygiene. List the purpose of oral hygiene. Explain the care of mouth procedures for unconscious patient. This already I have explained. Okay, so for conscious patient there is no self-care deficit we can't see. Okay, but when it comes to the unconscious patient, we have to do directly care the patient. Okay, we have to maintain the oral hygiene and all, the brushing and all we have to do. Okay, that procedure, what are the equipments we are using, what are the procedures step by step we used to do. Okay, all those things you have to write. I just give the hint how to write. So the procedure, once you study thoroughly you can write it down. Okay, the next one is what are the purpose. Okay, so to reduce the oral decay and all. Okay, so in commonly we can tell. Okay, so that is the purpose, right? So for that reason and what we will what we can tell that oral hygiene, why we want to do every day you are maintaining the personal hygiene, no? So to in order to reduce the inappropriate or bad smell or bad odor of the mouth. Okay, so for that reason we need to maintain. The next one is, if you want to like your friends will be there, means kindly inform them. Now the session, important question session has been started. They can join and they can also take the questions. The next one, the next you have to go with define enema. Define enema. Define enema. List the classification of the enema. Explain the procedure of giving medicated enema. Define enema, list the classification of the enema and explain the procedure of giving medicated enema. Okay, so this is also one of the very important, thoroughly study about the enema procedure and its classification, use a flow chart, write the classification of the enema. And the next one, explain the care of death. Okay, so explain the care after the death. Okay, so that is also one of the very important, for 6 marks they have asked in the previous year question. So for you people also there may be a chance to get the questions. Okay, so this one will be clear, this one finished, this much you finished. Now you take next question. Okay, if you finish this much, put a comment, I will go with next. Atul, comment. Shall I move? Shall I move with the next question? Okay. Anyhow, I will go with define comfort devices. Define comfort devices. List down the comfort devices. Okay. So, first we have to define the comfort devices and list down the comfort devices, and the next one is explain the uses of comfort devices and write any one detail. Okay, so any one comfort device you have to explain thoroughly. Okay, first you have to define it and list down the comfort devices. What are the comfort devices? Devices will be there, that you have to list down, and the next thing you have to go with the use of any one. Okay, so uses of comfort devices and explain any one in detail. The next one is define oxygenation. Okay, the next one is define oxygenation. Define oxygenation. Explain the types of oxygen administration. Okay, so define oxygenation and as well as you have to write the types of oxygen administration. Okay, so these are the important questions. The next again you take again the important question. Again I am telling, define enema, list the types of enema and explain in detail about simple enema. Okay, one classification will be there that they have asked directly here. Okay, so the next one is again in the long essay form of question, define first aid. Okay, enema finished, no, so that is for sure you there is a chance to get that question. Okay, so the next one is define first aid. Define first aid, golden rules of first aid and principles of first aid. Okay, certain golden rules will be there in the first aid. You have to act immediately. Okay, so those are shift the patient immediately to the necessary area, to the necessary care, provide the necessary care to the patient. Okay, so certain golden rules will be there that you have to write. Okay, again first aid is the important question. Okay, so have you taken? Next we can move with the, okay, in this particular, once again I will repeat, comfort devices. Again the comfort devices is important. Again we come to know that oxygenation and the administration, the types of oxygen administration you have to know. After that you have to move with the define enema and the types of enema and the uses of enema and write about simple enema. Okay, the next one first aid. These are the important questions in the nursing foundation long essay type of questions. Okay, the next one we will go with the answer the following again. Define decubitus ulcer and list the causes of decubitus ulcer. Explain the role of nurse in caring and prevention of the decubitus ulcer. Okay, again it will comes under the personal hygiene. Okay, so the chapter you have remember, no, so there it will become. Okay, so there you have to be study more. Okay, the next one, define nursing and list the essential qualities of a professional nurse. What are the qualities and conduct of the nurse will be there, no? So that is also one of the very important. Okay, so these two are clear. Next, shall I move with the next questions? Define admission. Define admission. Explain the types of admission. Explain the types of admission. Define the drug administration, that I already explained, the rights of drug administration. Okay, so and type of administration means certain different types of administration of drug will be there according to the route. Okay, so that one, and explain, mention the different routes. Again it will come here, the routes. Okay, so major topic we have discussed today, so that is very important. If drug administration and explain the procedure for oral medication. What is the procedure? Simple procedure we can write by yourself in your own way, right? No, so deeply, thoroughly study the drug administration properly. Each and every route according to the types, according to the procedure of administering the medications in each and every route. Understood? Okay, so this is all about the long essay. Again we have certain few. So shall I move with next? So the next one is define normal temperature, again which will be comes in the vital signs. Okay, so define normal temperature, write the different methods of checking temperature, which is the most suitable site to check the temperature in children. Okay, so that is rectal. Okay, so we have certain different sites to check the temperature, right? So that you have to study thoroughly. And again we want to know that we have to know what is the normal temperature. Okay, the normal range of the temperature, body temperature. Explain the nursing management of the patient with hyperpyrexia. The person is having the high fever. What is your nursing management? What is your action to reduce the body temperature of the patient? Okay, so we need to provide the tepid sponge. Okay, so we have to do the cold application and all will be there, right, to reduce the fever. Okay, so these are all the things how to manage the hyperpyrexia. Pyrexia means fever. Okay, so that you have to go through. The next one we have to know that Again, list the signs and symptoms of the dying patient. Critically, terminally ill patient will come now. So, there you have to know this. And the next one is explain the nursing care of the dying patient. Next one, define fracture. Explain the nurse's role in providing a first aid for the fracture of femur bone. Okay, so fracture is also one of the very important. Okay, broke down of the bone we will call it as. Okay, so I will see once again whichever if I left I will complete that one. So once again I will tell the important questions. Okay, important questions we have come to know from first decubitus ulcer and all that management, everything you should know. And the next one we have to go with the nursing, define nursing. Again they are asking about the essential qualities of the nurse. Okay, so that is over. The next one they will ask about the define admission, types of admission and the management of the admission. Okay, during the admission. The next one they will go with the drug administration. Drug administration is also one of the important topic. Again I am telling enema is one of the very important topic. We can put a 100 star on that. Okay, and vital signs, temperature, hyperpyrexia. Okay, so all these things are the very important. Now we can go with the meaning. Okay, one mark question they may ask health, communication and first aid, immunization, ethics. Okay, that and all we have discussed, right? So all those things you have to study. And anyone question will come mostly. Nursing foundation. Anyone know one question will come mostly? See, if you study in these question, definitely one will come. One in the sense, in this only particularly we can expect the questions. Okay, first one only they will give means they have to get the paper, right? So at least important questions list it down and write it down and keep with you. Okay, this is the strategy actually. So you have to write it all these whatever I told you, know that important questions. If you written means what it will be happen, if you are daily studying, now also you not started means no issues. Okay, whatever I given that go through that. Okay, so most probably we are giving like 99% coming questions only we are giving. Okay, so that much important questions we are picking and giving. If you writing that, definitely the expected question, the paper, once you will see the paper you will definitely feel happy. Okay, so the next one, and medical administration of drugs and all. By seeing the syllabus only you come to understand where they will ask which kind of question. Okay, if you are what ma'am, one won't predict one question. What ma'am won't predict one question? How you will predict? I have a doubt. You can't predict, no. We can tell that according to the analysis of the previous year question paper, but we can't tell that particular that one only will come. It is not possible. Okay, so in this important topic we can tell that this will only come. Okay, so my prediction is that when I will study, when I was studying, by the time I used to study all the syllabus, when the syllabus we come to know what is the high yielding area. Okay, so the drugs medication administration is the high yielding area. So by that we are detailingly study that particular portion. Okay, by come to understand by itself we can understand. So that is the high yielding area. They will ask for the long essay. Okay, so this is how the prediction will matters, but I don't know how we can predict the question that particularly which will come. Okay, next shall I move with the fun marks? So health, first aid, immunization, ethics they will ask, and what is nursing? Okay, what is nursing? Dyspnea, asepsis, laxative, Decubitus ulcer, decubitus ulcer, decubitus ulcer, again I am telling you have to thoroughly study. Nursing process, okay. Nursing process I already explained. Nursing process, assessment, diagnosis, planning, implementation, evaluation, okay. Nursing process already explained. From there only they can ask what is diagnosis, okay, for 1 marks. What is nursing process, okay. Here they are asked about the dyspnea and asepsis, laxative, decubitus ulcer, okay. The next one they are asking about nursing. I told you, no, they can ask the definition of the nursing. And euthanasia, euthanasia they can ask reports. And nosocomial infection, I told you, no, the hospital acquired infections are also called as the nosocomial infection, infections which is coming from the hospital, okay. So if you are going to the hospital and getting the infection from the hospital, that infection we will call it as a nosocomial infection, okay. For 1 mark, for sure they may ask this one, either they may ask hospital acquired infection or they may ask nosocomial infection, okay. Bed making also they will ask, okay. Bed making procedure, types of bed making, everything you study. Wait for a while, you be with patience, we can finish it off each and everything, okay. So by the time you come to understand, again they will ask the definition of the health, profession, what is profession, pulse, okay, definition of the pulse, stomatitis, okay. So they will ask this one. So after that, the remaining 1 mark questions we can predict like infection, okay. Infection we can predict, either they may ask the nursing process, what is diagnosis, what is assessment, okay, ethics, okay. So this is the things, laxative and all I already told, no. So those are the things which we can expect from the 1 mark, okay. So now we can move with the short essay type of questions. They can ask qualities and functions of the nurse, barriers of communication, what are the barriers of the communication, maintenance of intake and output records. I told you that that time only, right, while administering the catheterization or any ill patient, we have to maintain the output and intake records in certain like different kinds of conditions. The next one, care of unconscious patient, that is also one of the important. Methods of assessment, physical assessment, physiological assessment, psychological assessment, we have discussed, right, they have asked that one, okay. So that is the thing. And the next one is care of the dead body, the care of the dead body, again it is important. In the long essay also they have asked, in the short note also they are asking. Nursing care of patient with a fever, okay, from the vital signs it will come, nursing process there it will be there. Then care of patient with the burns, first aid, okay, so this will comes under the first aid. The next one is steam inhalation, okay, which will be comes under the procedure. So this is the thing which we can expect from the short notes. So the next one we have list the golden rules of the first aid. Again I told you, no, in the last, list the golden rules of the first aid and explain the uses of exercises, okay, body mechanics, there it will come. The next one is explain the steps used in prevention of infection. To prevent the infection we are using certain things, right, quarantine, isolation, and we are using the personal protective equipments to curb the infection, okay, all those things you can write. The next one is nurses role in maintaining the good health. What are the nurses role? That I have written, no, the role of nurses to provide the like preventive, promotive and curative health care. That is one of the main aim of the nursing, right, so that you have to focus more. The principles of bed making, somebody is asking bed making, they will ask, okay, so you can write the principles of the bed making, okay, certain principles you have to follow during the bed making. Again, see, when it comes to the again short notes, nursing process, care of terminally ill patient, care of terminally ill patient, care of dead body, so that is very important. The next one is care of pediculosis, okay, so the lice which will be there, no, Okay, for that one procedure will be there, how to provide a proper care for the pediculosis, that procedure you study. Okay, then first aid for drowning. Okay, the first aid for drowning. In the first aid, first and foremost thing, long essay, short note, pakka questions will be there from the first aid. Okay. So next one we will go with the define comfort devices, list down the comfort, sorry, one second. The qualities of the functions and nurses, again they will ask that only. Autoclaving, sterilization method, autoclaving they have asked, and essential good communication, urine test for sugar, the Benedict test also will be there, another test also will be there, you have to write that one. And the next one is care of rubber goods. Okay, the devices will come now, there it will be come the care of rubber goods. And the next one is types and purpose of position. Okay, types and purpose of positions, you have to study the different kinds of positions will be there, no, lithotomy position, side lying position, supine position. Okay, all the position and the purpose of the particular position in the posture you have to study and write. Okay, the next one, nurses responsibility in administration of steam inhalation, cold application, factors affecting the pulse, and golden rules of the first aid, golden rules of the first aid. Okay, again repeated. Okay, so that there may be a chance. So next we will go with the oral hygiene, universal precaution in infection control, and records and reports documentation. From there it will come active passive exercises, body mechanics, and the route of drug administration, different routes of IV, IM, intraarticular, intraosseous, epidural, and intradermal, subcutaneous. Okay, all those things. Okay, now I can tell easily, but for you need a little bit of practice. Okay, practice it and write. Okay, while writing also no need to write only points, you have to write what it is. Okay, so that matters a lot. The next one, collection of the urine specimen, how to collect the urine specimen, whatever the things you have to do before going to collect the urine specimen, that you have to write. Sitz bath. Okay, so that is also one of the important procedure. Methods of physical examination and role of nurse in the physical examination. Okay, so the methods of physical examination and the role of nurse. Diet in sick and illness, diet planning, menu planning according to the condition. Okay, so that is also very important. See students, one thing I will tell you, see, if you written means questions, definitely you will pass. Okay, if you are simply listening to it, no issues. If you are now you are listening, listen. After finishing of the class also, once again you watch this live session, write it down the question. So from that questions only, for sure the question, most of the important questions we are discussing. Okay. So here everything was done. Okay, everything, the two 5 marks, short notes also finished, long answers also finished, and we have finished the meanings also. Okay, so from this only which will come, and remaining and all, fill in the blanks and all you study, from that only it will be there. Okay, in between of this only definitely you will take the 4 marks from there. True or false, by your objective type of questions you can easily analyze it and you can finish it off that also. Okay, so we have completed the question paper analysis. Now I will come to the exam, how to write. Okay, so somebody else asked me that how many marks we want to secure to pass. Okay, so most probably we are getting 38 marks. Okay, so 38 to 40 marks range we are getting, means we will pass in the examination. Okay, so okay, this is the range of passing marks. Okay, so 1 or 2, 3 marks I used to tell more only. Why? Because if you are keeping your target for 35, okay, sorry, so 35, again you will get less than that. Okay, so for that reason. Okay, so leave it off this. Okay, we will go with the paper writing pattern, paper presentation we will call. So in the yesterday class, somebody else asked nice paper we will get, how the paper will be there. Don't bother about that papers and the paper was very nice. You may see the paper, you likes to write on it, okay. So that kind of answer paper will be given by the board, okay. So don't worry about that, don't be confused, don't be get fear, okay. Whatever I have given, no, study, okay, study this much, okay. Study, download the question paper, previous year question papers from our application, or else you want to download, you can go through the website also, okay. The board website also you will get. Most probably if you come to our application, if once you visit means definitely you are going to get the entire resources over here, okay. So that is the reason you once you visit, once you download in the Play Store Nursing Guru application, and the things which is very easier for you are better performance in the examination, okay. Leave it. Now we can go with the paper presentation pattern. When it comes to this paper presentation pattern, here we have certain pages like this, okay. So when it comes to GNM, I was attending BSc examination, but I want to tell you guys the key concept and the key of passing in the examination. The paper presentation matters a lot. Why? Because I'm telling, so if you're writing a story, okay, so the story you are writing, so it will never looks good, okay. So in that story we have to put some masala, okay. So that kind of tricks I will tell now, okay. Whatever you are writing, enema, suppose you are writing about the enema, okay, the concept, right here definition, okay. So first we will start with long essay, means start with a small introduction, okay, intro, few points, after that definition, according to whom, according to whom you write. Try to write two definitions for long essay type of questions, okay. Here they are not mentioning this is long essay like that, but once you see the marks, you come to understand that which one is long essay, okay. Understanding what I am telling. So by in that answer the following questions will be there, no. So most probably those are the long essay type of questions, okay. Understanding, right? So there you do one thing. Voice idukku cut akono. Now it is clear. Now it is clear. So will the evaluation of paper be gentle? Do we need to write all 40 pages something? So see, my suggestion is that write something wherever you don't know the particular topic deeply, okay, but you have to write the exact answer, okay. Here you are coming to score better marks, right? So for that reason something we are writing, we will not get the marks, okay. If you are attending our live session, definitely you will pass, that is, there is no question in that. I am telling you, you will definitely pass with this, okay. So but you have to follow what I will tell, that is the thing, okay. So while writing here you have to follow the definition, after that classification will come. Classification you have to explain in the flow chart, okay. If it is correct classification, you know, otherwise in the flow chart if you are written the wrong things, definitely you come to understand, or the evaluator will going to be catch you very easily, okay. So for that reason you have to use that, okay. Otherwise you can write it down in the point wise, like you can use like bullets, okay. So then you can write it down. Next thing, after that you are going with the procedure, okay. So while writing the procedure, nursing foundation, far and foremost they will ask the procedure, bed making, enema, okay, or else they will oxygenation or oxygen inhalation, and they will ask patient care for the pediculosis and all, they will ask, no. So while writing the procedure, write here the procedure name, okay. After that write down the things which is related to the what we can tell, which is very easy, okay. First you have to write what are the equipments which will be needed for that, okay. Equipments needed, okay. And bed making, we have certain types of bed making will be there. Okay, so there you have to mention the types also. Okay, after that equipments, whatever the things in the procedure, whatever the equipments we needed, that you write, and purpose of doing this procedure. Okay, purpose of doing this procedure and the steps. Okay, steps of the procedure. So like that if you are writing, definitely you are going to get the good marks. Okay, so if any doubt, the booklets have how much pages? Okay, around uh, 50 pages will be there. So 50 pages will be there in the booklet, so you can attend all the questions easily. Okay, so there is no doubt in that. So like this, if you follow, and while writing the role of nurse and all, use the schematic representation. Okay, you can use certain schematic representation. If I am telling about the schematic representation, people not knowing how to do the schematic representation. Okay, so use a different kinds of shapes or something else. Okay, highlight the headings, whatever you are writing. Okay, suppose you are writing this particular point, highlight it. Okay, so by knowing itself we come to understand the student has been written this answer only. Okay, so that is the thing. Okay, write a role of nurse in each and every procedure. Okay, so that makes sure you to get a good marks in the examination. Okay, hope you guys are understood very well. All the best for your examination, and as well as if you have any doubt, I will give 2 more minutes, you can ask me. I will definitely clear with that. I'm gonna clear you. Any doubt? Can I wind up? Atul, everything is okay? Everything was clear? Should I wind up the class? Okay. So far we have discussed everything, and if you are not catching by this time, once again you go and visit our YouTube channel, subscribe to our channel, and once again you listen, sit and listen again. Okay, so write it down, all the important questions, thoroughly practice down. Okay, definitely you will pass in the examination. Okay, okay, bye everyone, all the best. Thank you. Meeting the